I wanted to try the Sunoh and see if it would speed up the practice, and it was fantastic. We went from having 30 plus day delay on charts being completed to our charts being completed every day. I think the best part of it, what my providers loved, is that they could hit play and then take care of their patient instead of worrying about taking notes or typing on the computer. And then they would turn around and have a very complete and very robust chart. That's been a game changer. On the revenue cycle, whenever you're delayed in getting those charts locked, depending on the payer, by the time it's coded and billed and sent in, you're really coming up on a hard deadline of meeting timely filing. And if there's any problems, if it gets rejected for any reason, then you've lost the chart. So we were always playing catch up and just barely getting or losing claims due to us not being timely. And the AI, now we have the chart completed and it's coded and ready to bill the next day. And when I looked back over the last year, the cost of the Sunoh is just such a small percentage of what I was writing off. It's going to just become part of our life.